One of the ongoing issues during this time of COVID is a collective level of grief due to losses by so many people. Andrea Warnick is a psychotherapist who specializes in grief counseling. Andrea, thanks for joining us today. Grief has been called the hidden health crisis. How is it impacting our mental health?
Well, there's so much grief that's been experienced through the pandemic. People are grieving job security, financial security, being with people that they're close to, and not being able to be at the bedside when their loved ones are sick or are dying. And I think it's important for people to keep in mind that grief in and of itself is not a mental health crisis. Grief is a natural response to a significant loss. But when it doesn't get the right support, it can absolutely turn into mental health challenges. And that's why we think it's so important to make sure that people are showing up for people right now while we're all grieving.
I think that's a great point. Grief is a natural part of our lives. So, how do we make sure that we are grieving in a healthy way, that we're actually facing the losses that we've seen in our lives this year?
Part of it is just finding space in our lives to do grief. One of the biggest parts of my job is convincing people that there's actually utility in allowing yourself to feel your feelings, to feel disappointment about that graduation that didn't happen or didn't look anything like you anticipated it would, to feel disappointed about not being able to be with your family members and grief at the end of their life and things like that as well. And I think part of what we're dealing with is there's this myth in our society that to allow yourself to feel vulnerability or sadness is a weakness. And it's very much about reframing that and actually understanding that as humans, we're designed to be able to go through great deals of suffering and survive it. But it's important that we make spaces to feel those feelings.
Yeah, I think that's a great point. With over 13,000 deaths and going across our country today, we're also seeing businesses being shut down and livelihoods being affected and relationships impacted, as you alluded to, Andrea. What is the answer to those who are seeing years of hard work being compromised?
I don't know that there's a good answer, Maggie. It's a devastating situation, and that's where I think it's just really important that for any of us who are, have people in our lives who are grieving their livelihoods, their business that they put their heart and soul into, and things like that, that we're really showing up for them and we're, acknowledging sort of the heartbreak and their devastation and everything else. And I think whenever possible, for organizations and really, I wish it could be seen at the government level that it's important to be putting grief support in place for people so people are able to get access to good, well informed support as they're grieving these losses.
Because I think when we think of grief, we're thinking about losing somebody, we're thinking about death. But there has been an element of just letting go of expectations, letting go of things that we had hoped for in 2020 as we're in the beginning stages of 2021. And maybe just, and I would love your input on this, maybe even rethinking the word grief and what that looks like in our own lives and how it's acted out.
Absolutely. And when I work with little kids too, and I always explain to them that, grief isn't just when somebody dies, it's anytime we have a big loss in our life. So that includes being so excited about going to summer camp and not being able to go to summer camp or to visit your grandparents and then not being able to see them for 9 months or a year. And that's where I think it's really important that we expand our definition and understanding of what grief is. It's any time that we have a significant loss. And so living through a pandemic has provided so much opportunity, and so many reasons for people to be grieving on top of those who are also grieving, deaths happening in the families, illness happening, and not being able to be connected. Because I think one of the things that we need to keep in mind is that as humans, most of us are wired to want to be with and connect with others when the really hard stuff goes down in our lives. And the pandemic has created huge barriers to that, and thus has created huge barriers to a healthy grief process.
Yeah, that alludes to my next question. There's something about being physically with somebody in a world crisis like natural disasters where people are coming together to support each other with a situation like this, where we're being told to stay apart. And how do you reconcile that? How do you find hope in that when you can't be physically close to somebody?
That's where sometimes, we've got to get creative in terms of what does that look like the return to age old art of letter writing, or certainly
Mhm.
Zoom. I mean, I know even some families I've worked with have had actually some very meaningful and powerful memorials over Zoom. But there's also just part of it that can't be replaced, and it's knowing and reminding ourselves that this will not last forever, but also
Mm.
making room for it to be hard and for us to miss those people in our lives and being with them in a physical and, in a close proximity. And that's where, I really hope that when we are able to be back together, that that's something that we won't be taking for granted in the way many of us, including myself, probably did for a
Yeah.
long time.
Yeah. You're a psychotherapist, but you're also a nurse. Let's talk to healthcare workers and frontline workers. What's the advice that you're giving your coworkers who are frontline workers and just how to process this as they are seeing loss? They are also have lost a lot, this year as well, and just processing this grief that we're all seeing.
One of the biggest things I'm encouraging people is to be gentle on themselves. I mean, it's
Mm,
natural that we're going to see a whole lot of burnout and empathy fatigue and everything else right now. But I think it's so important, again, back to that piece around making some space to do grief. And often when people are seeing so many deaths happen in a close period of time, there can be what we call bereavement overload, where you don't have time to
mm,
process it all. So, when possible, taking that pause, making space to do the feelings and everything else, not push them to the sidelines, but also for people in their lives to continue to acknowledge the people on the front line. We were really good about that in the first months of the pandemic,
yeah.
and I find that now people have gotten wary and it's not as much on the forefront for many people. And that act of expressing gratitude to everybody on the front lines, there's tons of people making minimum wage and are on the front lines, delivering things, working in stores and everything as well. Really being able to express our gratitude for all of those people.
Mm.
And I think, again, organizationally, wherever possible, weaving in good grief support where it's not necessarily, the person who's exhausted on the front lines having to reach out and find someone to support them, but organizations helping making that easier for them to access those services.
Oh, so good. Andrea Warnick, grief psychotherapist and also nurse. Thank you, Andrea, for all of your hard work on the front lines. We so appreciate what you and all those who stand alongside you have done for our country and our community. Thank you.
Thank you, Maggie. My pleasure.